According to the CDC, about 3 million Americans have glaucoma, which is the second leading cause of blindness worldwide. The CDC also estimates 50% of people with glaucoma don't know that they have it. Welcome to Impact Moment, brought to you by DCTV. I'm Rebecca Burnett, and today I'm joined by Dr. Leslie Jones of the Prevention of Blindness Society of Metropolitan, Washington, to explain how the organization is improving adults' quality of life. Welcome.
Thank you, Rebecca. Thanks for having me.
Now, Dr. Jones, you're the Associate Professor and Chair of the Howard University Department of Ophthalmology. Can you kind of explain to our viewers how you and the society kind of work in tandem and what your role is?
Well, I'm proud to be a board member of Prevention of Blindness, Washington Metropolitan, DC. And essentially, I have been working in the community for over 20 years, fighting in particular glaucoma blindness. I'm a glaucoma specialist as well as chair of ophthalmology at Howard University. And so we have a shared mission to increase awareness of glaucoma in our community. Glaucoma is a host of different types of disorders that end in damage to the optic nerve. The optic nerve is in the back of the eye, and it's seen by the eye doctor once you have dilation of your pupils. In our exam, we can take a look and see if there's damage to the nerve. Unfortunately, the conditions that cause glaucoma, many people are unaware, do not have symptoms as the damage is occurring. And once they become aware, it's often very late in the disease stage. Early on, a patient really is asymptomatic. And that's why once a person knows they have vision loss, it's due to glaucoma, it's often very late in the disease. So individuals definitely need to be checked once they're age 40 or older if they're of African descent, and in other races, age 60 or older, to make sure your doctor can make you aware if you have the disease or if you're at risk for the disease.
And I know that the Prevention of Blindness Society of Metropolitan Washington is working on a new glaucoma program to eliminate barriers to treatment. Can you kind of preview what that might look like, but also what are kind of the best ways to remove those barriers to make sure that people have the resources that they need?
Well, this program is entitled See for Yourself, and it's really making individuals aware of when they need to have examinations, about the prevalence of glaucoma in their community. In Washington, D.C., that's around 3.1% of residents, or 10,000 or more individuals have glaucoma, and that's much higher than the prevalence of the disease in the U.S. overall, which is around 1.9%. So it's to make people aware that this is a problem. It's a public health problem, that it's very prevalent in the community, and that you need to have your eyes evaluated because you may not have symptoms early on in the disease.
So besides this new program that you're rolling out, what have you been doing in the years since your founding to sort of combat glaucoma and spread the word about the disease?
So for many years, Prevention of Blindness has been engaged, and for the past 20 years, I have been engaged in screening programs throughout the city. Screening and early detection is key, but once you are detected as someone at risk, it's very important that you have follow-up care and a full eye exam. And as I may have mentioned before, that you have dilation and evaluation of your optic nerve by an ophthalmologist. In addition, POB has many education and awareness activities. Health literacy is key, making sure that individuals know that they need to have an eye exam at least every 2 years. And if risk factors are identified, their providers can let them know if they need to be evaluated more frequently. But POB gets the word out about awareness and making sure that people avail themselves of the resources that are available.
Well, it's wonderful work that you all are doing. Where should people go if they want to learn more information?
Well, in particular about glaucoma, you can learn more about the See for Yourself program at glaucomadc.org. And you can go to the Prevention of Blindness Society, Metropolitan Washington's website to learn more about our organization and to learn more about how you can use the resources that we can make available to ensure you have good vision and can function well in your environment.
Well, thank you so much for taking the time today. I really appreciate it.
You're so welcome. Thank you for having me.
And thank you to our viewers at home for tuning into this episode of Impact Moment. It's part of DCTV's nonprofit capacity building grants program, bringing meaningful media to the DMV's nonprofits that are making a difference. Find out more at dctv.org/grants and stay up to date with our latest productions on our live stream at dctv.org/live.